Okay, in this video I'm going to demonstrate how to perform the Z-Track intramuscular gluteal injection. And remember that the Z-Track is like a gluteal injection, and it's going into the muscle, but we're going to pull the skin before we give the injection so that when we pull the needle out, the medication doesn't leak out. Of course, the first thing you want to do is you want to get consent. So hi, my name is Carlos. I'm the medical assistant. The doctor wants me to give you an injection. Is that okay?
Yeah.
Okay. Always want to make sure that the patient is giving consent to it. Also, you need to identify your patient. So ask the patient to state their first and last name, and then also to give you their date of birth. That gives you 2 identifiers. The next thing you want to do is you want to make sure that the patient is not allergic to the medication you're using or to the supplies that you're going to be using. So ma'am, are you allergic to any medications?
No.
Okay. Are you allergic to alcohol, cotton, or metal?
No.
What about the adhesive on tape?
No.
No. Okay. Very good. So I'm going to go ahead and draw the medication up, and I will be right back. If you drop any of your supplies, you can't reach down and pick them up. You have to go get a new one. You can pick it up afterward. You just don't want to contaminate your hand. Okay, we're going to go ahead and drop the medication. So the first thing I'm going to do is prep my syringe. You can start by also prepping the top of your vial. Let me just go ahead and start with prepping the vial first. We're going to check the label, make sure that it's the medication that's being ordered, check the instructions and the expiration date. Clean it very vigorously with that thumb, and then we're going to go ahead and start prepping the syringe. Loosen the plunger, loosen the cap, and draw it down to that 0.05. Check your label now for a second time. Okay, and now we're going to go ahead and drop the medication. First, we're going to place the needle into the rubber stopper. We're going to turn it around, inject that little bit of air, and then draw the medication down. Once it's drawn down, use your finger to tap. You can use a pin, but use something to strike the barrel of the syringe to get those bubbles to go to the top so you can put them back in. Alright, so we got rid of the bubbles. And recap that single-handedly, and then we're going to check our label now for a 3rd time. Okay, looks like everything looks good. Now we're going to go over to the patient, and make sure to have your spot band-aid ready, your cotton ball, and your syringe. Okay, so what we're going to do is I'm going to come over to the patient, and just like the gluteal, we're going to lift the shirt up. Is that okay? And we're going to palpate. We're going to palpate the crest of the iliac, and we need to kind of turn this down sideways. Okay, like this. We're going to palpate. But this time, instead of using the thumb to split the cheek in half, I'm actually going to use my entire arm. Notice how my arm is resting on the side of the buttocks, and we're going to pull the skin pull with a lot of force. You can see that it almost feels like maybe I'm going to turn you over. Mm-hmm. Okay, so we're going to take the cap off and pull the skin. Make sure that your arm is pulling the skin inward and down. Then we're going to inject the patient in that upper outer quadrant. We're going to switch hands now. Notice how I switched hands, but I continue to maintain the pull of the skin. We're going to then aspirate and inject, and then I switch back. Notice how I'm switching back, but the needle is steady the entire time. At this point, we're going to count 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And at this point, my hand is going to pull the needle out, and my other arm is going to let go of the skin simultaneously, really quickly, like that. Okay, and then we're going to take the cotton ball, and we're going to massage, and then put the tape on. Okay. And you're done. Thank you very much. Remember.